Thank you for coming here, Emily, to our City of Health. And I'll tell you a little bit about Sheba. Okay. Sheba is not a hospital. It's more than that. It's an idea. It's a concept. We are the largest medical center in Israel, largest medical center in the Middle East. 10,000 employees, 2,000 beds. It's a large institution, not only in Israeli scales, but also in world scales.
Yes.
We are also a very good institution. We are ranked by Newsweek for the last 4 or 5 years as one of the top 10 world best hospitals. So we are a good hospital. We are very strong in human capital as well. We have 10,000 people working here. 3,000 of them are physicians and researchers. And they are all clever scientists and physicians. And you know, wherever there are 2 Israelis, there are 3 synagogues, 4 opinions, 5 strategies, but 10 crazy ideas. So most of them are convinced they have the idea and the chutzpah to change the future of healthcare. And we have 3,000. So we believe that our goal is not only to be good, big, and strong. Mm-hmm. We believe that because we are big, good, and strong, we have another role in the world. And it's not only to provide the best medical care we can to the citizens of Israel. We believe that our role is to create global impact. And
I want to ask you something about your global impact. I'm from the United States. Good. Sheba has a global reputation for your cutting-edge, groundbreaking technology. So I was wondering if you can share with us some of your most proudest innovations here at Sheba Hospital.
So one aspect of our global impact is changing the future of healthcare with innovation. Israel is a startup nation. Mm-hmm. We try to capture the startup nation mentality of Israel with the best infrastructure and patients and data that we have here, and to create patents and inventions and medical innovation that can change the future of healthcare. I'll give you one example that can happen in Israel, maybe not as much in other places in the world. Mm-hmm. 2 guys that work in the IDF on algorithms that in the intelligence algorithms that try to diagnose what happens above ground, below ground, according to what they see above ground.
Wow.
They take digital photos of satellites and they have an algorithm and they analyze it. And they are discharged from the IDF and they come here to Sheba and they're joined to one of my Michigan physicians. Another clever guy is a physician, he's a radiologist, and they want to do something in healthcare, not in intelligence. Mm-hmm. He gives them 200,000 CT scans of stroke.
Wow.
Which is a digital photo as well. So they work together and they implement their algorithm on that stroke digital CTs. And they come up with a company, with a patent, which is called AI Doc, now implemented in 1,200 hospitals in the United States and in the world. They were the first to get FDA approval for AI algorithm, which is now very modern, very, very popular, but they were the first to get FDA approval for AI. They came out from here, and now they have big dreams to change the future of healthcare, how we can diagnose stroke before the human eye can do that. And
wow.
You can imagine how many lives we can save with that. That came up from here. I'll give you another example. I have a team that works here to try to find a solution how to fix the mitral valve, one of the valves of the heart, without an operation. Oh. They came up with an idea, an invention. They work here, joint effort with physicians, engineers, and other smart healthcare professionals. And we came up with a company, InnoValves is the name, and wow. we believe that very soon we have the potential to change the future of heart valve medicine. And I'll give you maybe another example.
The more the merrier.
I have 100. I can talk about hundreds of examples. And I have many people that have those ideas. Some of the physicians here that perform echocardiography, they saw that this is a very, very costly process. Mm-hmm. It takes time. It slows the diagnosis rate. So they came up with an idea. Why not to give the bedside clinician, every bedside clinician, physician, to give him a smart device that have an AI algorithm inside that can diagnose the the heart by echo without bringing 2 technicians, 1 cardiologist, big machines. And they created a company. Its name is AISAP. And we believe that now we implemented at Sheba. We are now contracting to implement that in Chicago and from there to all over the world. And these stories that I tell you, they rise up every day with several Meshuggah here. And this way, we provide them they have the chutzpah, they have the knowledge, they have the people, they have the patient, but we provide them the infrastructure, the guidance, the global network. And we provide them with our expectations, with our vision. We want to change the future of healthcare. And this is how I think we are driving forward, moving forward to make that happen.
Amazing. So it seems like you guys really emphasize research. Okay.
Yeah. Research is another part. Innovation is one part of what we do, but research is another effort that we believe can not only make us better and make the medical care that we provide to our patients better, but also to impact the world.
Right.
And we try to do that in several topics that, in some of them we lead the world, in some of them we are part of the groups that are trying to lead the world. And it can happen in genetics, in genomics, in other precision medicine efforts. We put a lot of effort in cell therapies, in regenerative medicine, in technologies for research to improve rehabilitation. We do it also in molecular biology. And through that, we think that combining science and innovation in a startup nation like ours, with the infrastructure, with 1.9 million people getting medical care at Sheba annually, and with the data that we have, we think we can impact globally.
You definitely can. And I want to tell you what I noticed walking around here so far. Everyone had a smile on their face, which is a little bit weird when you walk into a hospital. And I'm not talking the faculty, I'm talking
Despite the CEO. Despite the CEO.
Despite that. It was funny, I was seeing, amputees, people in the rehab center, and everyone's smiling. And needless to say, the world as a whole, we're all facing a huge crisis now with mental health. And I wanted to know, how does Sheba address the mental health and well-being of their patients here?
We are a bit different than other medical centers that probably in North America or in Europe. We have at the same campus, under one roof, we have a rehabilitation hospital, psychiatry hospital, and general acute care hospital, pediatric hospital, OBGYN center. We have all the centers of excellence, even post-acute care facilities in one campus. So we provide a different continuity of care. We look at the psychiatry and mental patients the same as we look at any other patient. And we try to provide them the best medical care we can. We don't look at it only one direction. There's another direction. We believe that this psychiatry hospital also influences or impacts the general acute care hospital and the OBGYN center and the oncology hospital and the pediatric hospital, because we now know that there's a strong part of the soul, of the mental, of mental aspects that is around biologic organic diseases. There's not the word that we as physicians knew that there's a division between organic diseases and mental diseases is no longer that. A lot of behavioral factors, a lot of mental factors influencing the other patients that are not in the psychiatry hospital. So, for example, we are leading in an effort to treat postpartum depression because we have a strong mental medicine, a strong medical or psychiatry hospital and a strong OBGYN center. So they combine. We provide different and unique programs to pediatric patients because we can combine mental and organic. And you ask me about the smile. Ask yourself, why do people smile? In general, why do they smile? Because they think they feel that they are doing something good. And at Sheba, if you don't do good, you're not here. This is the essence of what you do. You do good. So that's one aspect. The second aspect is that you believe that you're belong to something bigger than yourself, something significant. And I think people here understand that they are part of something which is bigger than themselves. They are not only individuals working with the patients. And I think they see the fruits. Mm-hmm. When a patient smiles to them, they smile.
Yeah.
And what for you seems nice or something to mention, for me, it's the day-to-day life is our DNA.
Yeah, it's amazing. Speaking of, going beyond Sheba, I saw outside, I want to let you talk about this, but Hope Without Boundaries. So I wanted you to give me some examples of how you guys go beyond traditional healthcare, and you guys are actually making more of a global impact way beyond Israel, way beyond the United States. Can you tell me more about that?
We talked about how we impact the world through innovation. Mm-hmm. And the other effort that we think, believe, and do it, that we have a potential to impact the world is through humanitarian outreach. Mm-hmm. We believe we have a role in the world, we call it Tikkun Olam. Because we can, we offer our assistance, our help, in any place in the world that needs a hand.
How would you call Tikkun Olam in English?
Call Tikkun Olam the aspiration to make the world better. Mm-hmm. That's our words in Hebrew to say that. We believe that healthcare has no boundaries, has no obstacles, has no barriers of language, culture, people, politics. We can work and assist everywhere. So we established here at Sheba a Center for Humanitarian Medicine and Disaster Response, because we have a lot of experience in Israel with that. And the Sheba Center for Humanitarian Medicine offers help to any country in need and extends a hand to any person, to any fellow man. We worked in Haiti, in Kosovo, in South America, in Guatemala, in Africa, in Samoa, in Italy during the Corona, in Mozambique, in Tanzania, in Eastern Europe, wherever people needed help. And the last mission we've done is in Ukraine.
Wow.
We deployed a field hospital, the only state-level hospital. The state of Israel decided to deploy a field hospital near Lvov, in the battle zone, in a city called Mositcha. And Sheba operated this hospital for the state of Israel. And believe me, for us to come back to Europe 80 years after my father and many fathers left Poland and Ukraine, for us it was closing the circle from killing to healing.
Wow.
And that's a privilege. And if this is something that the CEO says, that's okay. But when you move around here and you meet the people and you talk to them and you see how they operate, you'll understand that this is the spirit of Sheba, to extend the hand to any fellow man.
So I don't know if anyone told you, they'll probably tell you, after I saw the tents you guys set up in Ukraine, I was like, can I volunteer? And they're like, you need to go through some training, but it was so inspiring to me.
We get a lot of volunteers from the world. We open our gates for volunteers. We see that as a privilege to have.
So I can volunteer?
You can volunteer, for sure. I'm not sure what a sports reporter or sports journalist can do in a hospital like us, but I'll tell you what we share. What sports and medicine share.
Yes.
The aspiration for excellence. And coming from the sports world, you probably understand what do I mean when I say aspiring for excellence.
Yeah.
And I'm sure you can assist in many ways because it's very, very simple to help people during humanitarian crisis.
Amazing. So, my audience is primarily young people, and undoubtedly when they see Sheba, everyone's going to want to get involved. So I want to ask you, how do you think young people or anyone that wants to get involved can help make an impact with Sheba? How can we get involved?
First, this is the new world that we're encountering. We no longer think that any institution can do that alone. So we are very much interested in recruiting people, especially young people from all over the world that want identify with the values, with the vision, and want to be on board with us. We are building some ARC. ARC is our innovation platform, Sheba innovation platform, which is called ARC. We are building some in the United States, in Canada, in Australia, and in Europe. We have one that we are building in New Jersey. So
nice.
I'll call some young people from the New Jersey, New York area to join. It's going to be what we call the health space 2030.
Amazing.
We are going to build near the Liberty Science Park in New Jersey.
Wow.
Lab in the science city of the future. They're building this city there, and we are going to implement our ARC innovation platform there. So I call the young innovators, the young people in New Jersey, New York, Philadelphia area, join us there. We are doing. We have an effort in Chicago, in the Bronzeville in Chicago.
They could definitely
the
use
same ARC platform. We can join people there, and we have a global network working with many of the leading institutions in the United States, Canada. I'm sure it will be very simple if someone wants to address us to bring him on board.
Yeah, honestly, you guys should be so proud.
Thank you. Toda rabba.
Thank you so much for your time.
Toda.
It's an honor to be here.